Oh.
Cross your legs. Yeah. Face me straight on. You're a little sideways. There you go. Give yourself a hug and twist to the right.
Like this?
Yeah.
Like,
no, with the hug.
okay.
Left. Go right again. Go left again. So your left rotation's limited, but it's mild.
Okay.
Like I have enough to work with to get you started. So give me a sec. I'm going to write this down, but we're going to start with a way to do soft tissue work on your hip flexors. And then you always do that before you actually do your hip flexor stretch, which I'm going to walk you through.
Okay.
And then we gotta loosen up your, know your side bend's limited when you go to the right. That hip flex, loosen up that right hip flexor will help with that. But I'll also get you to soften up your QL muscle with the lacrosse ball. And then you could do a stretch for that after.
What's QL muscle?
Quadratus lumborum. It's a muscle that goes from your 12th rib to your pelvis.
Okay.
And then the third thing you'll do is sideline rotation for your T-spine rotation to the left that was limited. And then last but not least, we're going to do a nerve mobility exercise for your sural nerve. And that's all she wrote for today. You ready to roll?
Yep.
Okay. So I'm just going to change the view so that you can see me demonstrating some of this stuff.
Okay.
You see my yoga mat?
Yeah, I'm on mine right now.
So I got a foam roller here, a lacrosse ball here. You can kind of take your pick. Getting my lighting on point here.
Did you get your equipment yet?
Yeah, I got it actually.
Nice.
I have like these lights. The microphone, I need another wire, so it'll be nice when I have that, because even when I do these sessions, I don't have to like yell at my computer as much.
Yeah.
So the area you want to put this is going to be just lateral or just beside your navel, or maybe 2 inches up and 3 inches down.
Okay.
Okay. So I would lie on it, and if I'm doing it with a ball, you're going to spend some time going forward and back like this on the lacrosse ball. Keep your abdomen super relaxed, because where the hip flexor lives is in the front of the spine from L1 to L5.
Okay.
So from the front, the umbilicus is like L4. So you want to go a little bit above that, definitely a little bit below that, because basically, if I look at my clothes, it's at the front of the spine. It goes from here to the front of the hip, and hold your hip up, obviously. But
I didn't realize it went that high.
Yeah,
wow.
So it anchors off your low back. So you want to be hitting the front of your low back, soft tissue-wise, with something like a ball. We can try and see if we can do a little bit with this, but just be gentle. You're obviously going through the organs to do this. If it feels like something's wrong, then don't, but there's usually never an issue with this. It's a very effective way of getting that to relax. So a little bit lateral, a little bit to the side of the umbilicus, and up, down. Let's say a 6-inch span going up and down. And you don't have to be perfect. You're just lacrosse balling with a soft abdomen, breathing. And you're going like from above your navel, and then you know that it goes to the front of the hip. So you're kind of going in that direction. And you're going to spend 3 or 4 minutes doing that for both sides, especially the right side.
Okay.
Okay. Once you're finished that, you're going to move the lacrosse ball to the front of the hip and do the same thing, where the hip flexor tendon is.
Okay.
That's in the front of the hip, not the abdomen. And then I'm just going to roll around side to side. So it's cross friction. I'm going across the ligament of the psoas muscle, the hip flexor. And you keep the leg relaxed, and you go side to side. Like right there, I'm on the tendon. That feels nice and tight. So I'm going to work that for about 3 minutes.
Okay.
This is what you're not doing. You're doing really good stretches, but you're not including soft tissue stuff. And I think it's not enough input, just the stretches alone, considering how much computer work you do.
Okay.
Whenever you finish that.
So focusing more on the right side as well?
Yeah. So it just means pay a bit more attention to it.
Yeah.
And then your hip flexor stretch, I don't know if you're already doing this, but make sure you do a pelvic tilt. Do you do that?
Yeah, and it feels so good.
Yeah. Do the soft tissue work first, then pelvic tilt, and then hang out. Make sure that your right hand goes up, right? Like in the other video that I posted going through the hip flexor stretch, you saw that one?
I did, yeah.
Okay, so just make sure you're using those principles when you're doing that, but always do the soft tissue work beforehand.
Okay. Why the arm up, out of curiosity?
What's that?
Why the arm up?
Because the hip flexor has connections to some of the gut, some of the diaphragm, some of the pleura of the lung, and then links to the shoulder. You get a better stretch that way.
Okay.
We talk about myofascial chains and links, okay?
Okay.
I'm going to show you an alternative. You can pick which one you like more. Using like a foam roller would be the same idea. I'm not just going to foam roll this. I'll place it here and try and target lateral to the navel, going down to the hip flexor, same deal. Make sense? So I'm not doing just like the whole generic front of my belly. I'm doing on the outside of my navel about 1 inch, going front and back, but really relaxing your belly and trying to get the majority of the pressure right here.
Okay. So is that instead of the ball, or do that after as like a fourth exercise, a fourth stretch?
Take your pick, see which one works better for you.
Okay.
Okay, so let's just say you're going to do 2 minutes or 3 minutes, 2 minutes, let's say on the right, 2 on the left. Always go back on your right for an extra set.
Okay.
And then, remember we said your right QL, which is obviously tight as well.
Mm-hmm.
That's right here. So you have your hip bone right here.
Yeah.
The 12th rib is here. So it's like, this is the middle of my low back. You're going a little bit to the side. It's the side, like the big muscles that go along your back here.
Yeah.
And then you lie down on your yoga mat. You want a yoga mat just to soften it a little bit. And then I'm going to bring my leg up and down with that lacrosse ball squishing that muscle there.
Okay.
And again, I would do like 2 minutes on the right, 1 on the left, come back and do some extra one on the right.
How high is it on your back again? Or just kind of feel where it's tight on the right side?
So your bone, your pelvic bone right here ends.
Yeah.
Both ribs here. There's like muscle bulk right here, right? It's right on the side of the muscle bulk.
Okay.
Right? So you shouldn't be on bone here, or you shouldn't be on bone here. It's in that meaty part right here.
Okay.
And that will help with your side bend limitation that you have. And then the stretch that you're going to do after that one is going to look like this. You're going to step over your left leg, push your bum left. Arm can grab onto a wall like this. You're trying to create a C curve to try and open up your side bend.
Okay.
Okay, the front knee's bent. And then after, even before or after, I also want you to do the other side, because one of them is going to help close what you're tight on. The other one's going to help open it. Switch it up this way.
Okay.
You want to try it?
Sure. Is that hitting in the IT band as well?
Yeah. Just like fascial link wise, like the fascial chains I was talking about. Yeah, it does touch the IT band. So it's relevant for a few different reasons. Okay, so you're crossed, you got the wrong leg crossed. So yeah, you got it?
Front knee bent.
Okay. So that's good. I would say both your feet can come back 1 inch and to the right 1 inch. Yep. That right hand, I want it reaching higher. Okay, now I want you to push your bum to the right by allowing your right knee to bend.
Oh my gosh.
Left knee bend, left knee. And then there you go. That looks pretty good. I can't see your arm, but is it straight? Right arm?
Do you want both straight?
Your left one's more of a kickstand. That looks good. Do you feel that?
Oh my, yeah, I felt it right away.
And then breathe. Breathe deep through that and hang out. I would say start with this side and then follow up with the other side. Go ahead and show me the other side. Bend your front knee. Push your bum left. You okay?
Yeah, I should have been doing more yoga instead of running. Yeah.
Well, you can do a bit of everything as long as you know the routine that you need. Like this is the stuff that you need to be doing. You're gonna have to start doing a little bit more soft tissue work in combination with your stretches if you want to run the same amount of distance.
Yeah.
You good with that?
Yeah.
Okay. The next thing, I'm gonna get you to stretch out your sciatic nerve. Definitely hitting your sural nerve. So I want you to lie down on your back on the yoga mat. And grab the back of your right knee, 2 hands.
The back of my right knee?
Yeah, straighten your left. Okay, bring your knee to your chest more. And then I want you to straighten your leg while pulling your toes towards your nose.
Do you want me to touch my toes?
No, just like this. And then there. And then come back down. Did you feel a pull somewhere behind your leg?
Yeah.
Okay, do it again.
Kind of going up my back too.
Yeah. That's why I think your problem is a good percentage of it is coming from your back.
Okay.
So this takes the whole sciatic nerve. Specifically, I'm going to be targeting the sural nerve. And it takes it from your back. It travels through your glutes, your hamstrings, your calf, and then your Achilles. And it just slides it up and down. That's why it's called flossing. You're taking the nerve within your own tissues, your own anatomy, and you're moving it along so it's not entrapped or stuck along the way.
Okay. I like that. Ugh. I'm going to totally do the other side because it felt so good.
Does it feel the same or does it feel different?
It feels different.
Yeah.
I feel it less in my back and more kind of my hamstring glutes.
Got it. So go back